Good morning, everybody. I'm so glad that I can help you guys out with some diabetic information today. I used to walk those halls that you all teach in, and so don't tell anybody, but Share Mutual's my favorite. So let's go ahead and get started here. Understanding type 1 diabetes, I've got a cute little video I want to show you that's, I feel like, kind of motivational.
I like to floss. When I grow up, I'm gonna be a snow cone maker during the day and a ninja during the night. I like to do karate. Speed dinosaur. I like to make short movies. I have 200 stuffed animals. The Dexcom reads my number. That means my sugar is going up. Hey Siri, what's my sugars?
You're 123 and steady.
I can still do all of the stuff like everybody else.
Okay, important takeaways from this presentation. Type 1 diabetics do not produce insulin at all. Type 1 diabetics must have insulin injections, either through syringes, pens, or pumps, and we're going to talk about pens and pumps today. After a short-acting insulin injection, the student must eat. And type 1 diabetics need carbohydrates, just like everyone else, for energy production. The pathophysiology of diabetes, the body has to have energy to function. And things like keeping your heart beating, your muscles contracting, your brain sending and receiving messages, basically to stay alive. That energy is called ATP. And ATP is to your body as gasoline is to your car. And we all know what happens if your car runs out of gas. Where does ATP come from? Cellular respiration, which is a series of chemical reactions that happens inside the mitochondria in all of your trillions of cells in your body. Just as you're sitting here right this very second, you are producing ATP as energy. And you get that from breathing and eating carbohydrates. Two things happen to produce ATP. You breathe. Number two, you eat carbs. Diabetics must have carbohydrates to stay alive, just like everyone else. So what is the deal? The deal is diabetics actually have a hormone problem. What hormone is that? Insulin, which is secreted by the islets of Langerhans inside the pancreas. Insulin is key that opens the gate that allows the carbohydrates to actually go into the cell in the form of glucose. Now, type 2 diabetics may still produce insulin. They just have lost the ability for that gate to open to allow the insulin in the form of sugar to go in. But type 1 diabetics don't produce any insulin, so they have no key, they have no insulin, they must have insulin. So what is the bottom line with type 1 diabetic care? Balancing the carbs they eat with the amount of insulin injected into the subcutaneous layer, which is the fat layer, and the amount of activity they expend. So practically, what do you need to do for your student? Number one, at the time ordered by the doctor, you need to check the blood sugar. With a continuous glucose monitor, all you have to do is just look at a phone. And you usually do this right before they eat lunch. Number two, you have to count the number of carbs that the student will be eating. I'll have materials provided for you for this. This is a really good source right here. I highly recommend you guys all print this out and study that. But a designated person in the cafeteria can do this and call the teacher that's going to give the injection in the classroom just before leaving to come to the lunchroom. If the student brought her own lunch, the mom may already have those counted and written down for you. The next step is using a formula provided in the doctor's orders, which you all have. You formulate how much insulin is needed for the amount of carbs they will eat. The fourth thing is, if the blood sugar level is above what it should be, you will also calculate how much adjusted dose you will add to the needs of the carbs that she will eat. So you may be adding more insulin than just what you figure here, depending on her blood sugar level. Then you're going to dial in the proper amount of insulin and assist the student to give the injection to themselves. And if they prefer, you will give the injection. I'm going to provide information on that for you about that. Then they must eat. This sounds like a lot, but once you see it on paper, it really is not difficult. You do much harder things than this every day. I know you do. This is a handout that's in a binder that you all have access to, but you'll have it on this PowerPoint as well. This isn't all the foods, but it's a pretty good indicator when you're doing your carb counts. Half a cup, when we're speaking about a lot of these, you can visualize that as being about what you could hold in the palm of your hand, or half of a baseball, if you can visualize that. Or on some foods, you may think of it as the size of a tennis ball, if it's a piece of fruit, about that size. So this just shows you, for a cup of vegetables that are in this category, that carries a weight of 5 grams. A half a cup of starchy vegetables has a little more carbohydrates in it, and so it has 5 grams. A half a cup of cooked beans, for example, is 15 grams. Rice and pasta, a third of a cup is 15, and a half a cup is 23. So carbs are a little bit higher in the pastas and in the rices. And like half a cup of fruit is 15 grams, or a size of fruit the size of a tennis ball is 15 grams. If it's something like a tortilla that's flat, every inch is 2.5 grams. So you would measure that tortilla, multiply it by 2.5, and that's how many total grams they're going to be consuming. This is what you all have access to that's going to show you how to figure out from those total carbs. So you'd add all that up, and you're going to do two things. You're going to divide that by 10, and that's going to be how many units of insulin you're going to get. The total carbs divided by 10 every time. That's how many units of insulin. But if her blood sugar is not in the range it's supposed to be, there's an extra step there. You have to subtract what her blood sugar actually was from what you want it to be. And so that extra amount of blood sugar that she has, you divide that by 50, and then that's going to be additional amount of units that you're going to give her. So in this particular example, 6 plus 3, you're going to give her 9 units. So let's see if you can figure these carbs. I'm going to give you a second here. We have half a cup of corn, half a cup of pears, and half a cup of rice. So you may want to jot that down and see if you can figure that out by looking at this. Here we've got the corn, we've got the fruit, we've got the rice. Corn, fruit, and the rice. Okay, let's see how you did. We had half a cup of corn, should have been 15 grams. Half a cup of pears, 15, and half a cup of rice, 15. So her total was 53. Okay, so here we are in our formula. The total was 53. We're going to take that total and divide it by 10. So in this case, we have 53. We divide 53 by 10, and so you should get 5.3 units. So that's how much insulin she's going to need. But her blood sugar, we're going to say in this scenario, was 300. So let's say that in her doctor's orders, it says that her blood sugar should be 150. You don't have to guess that. That's going to be told you. So you're going to look at her phone, look and see what her blood sugar was, and subtract the 150 from that. That's this step right here, 300 minus 150. So what her blood sugar actually was, it should be, that top number it should be. And so the answer is 150. Okay, now you're going to divide that 150 by 50. And that comes out to be 3. So that's 3 more units that she's going to have. So you add those two together. Again, I'm showing you the deal. You add those two numbers together. The 3 units and the 5.3 units, and you get 8.3. Most likely, most of your pens and your pumps, you'll have to round that to a whole number. So if it's 5, it would go up to 9, but it was 3, so it's going to stay at 8. So we'll just dial in 8 units. The continuous glucose monitoring, there's some things you need to know about that. They have to keep their phone within 20 feet of them at all times for it to be picking up the blood sugar reading. It will alert you if it's too high or if it's too low. So you'll hear a beep, you'll get familiar with what that sounds like. Then that's how you know if you need to either treat the blood sugar if it's too low or give insulin if it's too high, or whatever. You have guidelines that tell you what to do in those case scenarios. It's in that binder that you all have. So for example, we'll say that in this particular example, the patient was supposed to be between 200 and 100. And you don't determine that, the doctor tells you that. And so if the blood sugar was lower than that 100, you're going to give some carbs. So maybe 4 peanut butter crackers, maybe an orange juice. It could vary what those things are, what you keep in the classroom. That should say too high. I'm sorry, I need to adjust that. If it's too high, then you have to give insulin. I have a typo right there. That's too high, not low. I'm going to give you a little overview of how to use an insulin pen. And I'm just going to show one of these. This one's about 8 minutes, but I think it's very, very good and technical at showing you how to use an insulin pen.
Hi, I'm Dr. Emily Walker, a VA pharmacist, and I would like to discuss with you the proper way to give yourself insulin using an insulin pen. There are many different types of insulin pens available from the VA. In this video, I will be demonstrating one specific type of insulin pen called the Flex Pen. Other names of insulin pens prescribed by your provider may include Flex Touch, Solostar, or Quick Pen. What is important for you to know is that the correct technique that I will show you in this video is very similar to what you would use for any of the other insulin pens mentioned. Remember, what insulin to use, how much to give, and when to give yourself the insulin will be told to you by your VA provider. Let's get started. When you're preparing to give yourself insulin, you want to make sure that you place all the proper supplies on a flat surface ready to go. These supplies include your insulin flex pen or whatever insulin pen you may be using, your pen needles, an alcohol swab, and a sharps container. If you do not have a sharps container, you can use a heavy plastic container such as an old laundry detergent bottle and write used needles on the side with a permanent marker. Before injecting yourself, wash your hands with soap and water. When your hands are dry, pull off the pen cap from the insulin pen and set it aside. Next, inspect the insulin through the viewing window. Do not use the insulin if you notice a change in color or if you notice things floating in the insulin. By inspecting the insulin pen, you will also be double checking that you have the correct type of insulin. As I mentioned already, for our example today, I'm using the Novolog Flex Pen, which has been pre-filled with insulin aspart. After inspecting the insulin pen, put it down and open an alcohol swab. Wipe the rubber stopper on the end of the insulin pen with the swab. Allow the rubber stopper to air dry completely. Do not blow on the rubber stopper to dry it, as this will introduce germs from your mouth. Next, pick up the pen needle and remove the protective paper covering. Grasp the base of the pen needle and carefully screw the pen needle onto the insulin pen. Make sure the pen needle is screwed on straight and hand tightened so that it pierces the rubber stopper completely. Make sure you do not over-tighten the pen needle, as the pen needle base is plastic and can crack. Next, pull off the clear plastic outer needle cap. You will see a second inner needle cap still covering the needle. Remove the inner plastic needle cap. Both plastic caps can be disposed of in your regular household trash. It is important to always use a new pen needle for each injection to reduce the risk of infection. Never reuse or share needles with your family or friends. Next, we will complete an air shot with the insulin pen, which should be done before each injection. An air shot is sometimes called priming. Doing so removes any air that is trapped in the needle. Turn the dial up to 2 units. Hold your insulin pen with the pen needle pointing straight up and lightly tap the insulin pen with your finger a few times to make sure any air bubbles move to the top. Next, press the push button all the way in. The dial should return to 0. You should see a drop of insulin appear at the tip of the pen needle. If the drop does not appear, repeat the process. This can be repeated up to 6 times. If it still does not work, try using a new pen needle. If that doesn't work, then try a new insulin pen. Next, select your insulin dose. Check to make sure the dial is set to 0, then turn the dial selector to the desired number of units. The pointer arrow should line up with your desired dose. The dose can be corrected up or down by turning the dial. For example, if you are prescribed insulin aspart 10 units before meals, you will dial up to 10 in the pen window while making sure the arrow lines up with the desired number of units. Be careful not to press the push button while selecting your dose, or the insulin will come out prematurely. You will hear a click for each unit you dial. It is not recommended that you attempt to dose based on how many clicks you hear, as this may result in an incorrect dose. Please note towards the end of the insulin pen use, you will not be able to dial more than the number of units remaining in the insulin pen. Next, if your skin is not clean, use an alcohol swab to clean the site before injection. If you just bathed, you may not need to clean the area with alcohol. Remember, alcohol can be very drying to your skin, so you don't want to apply alcohol to your skin if not needed. Insulin can be injected into either your abdomen or stomach area, buttocks, on the high hip upper outer area, thigh, or upper arm. That is the back, fattier part of your upper arm and not the muscle area. The needle you are using is thin and may bend. You may find that pinching your skin gently before injection can prevent bruising and decrease the chance of bending the needle. It is recommended that you rotate to different sites each time you use the insulin pen. If you plan to be physically active right after the injection, it is recommended to rotate around your stomach area only, rather than to the arms, legs, or buttocks. Avoid injecting insulin into any area of skin that has pits, is thickened, or has lumps. Avoid injecting where the skin is tender, bruised, scaly, or hard. In addition, stay 1 to 2 inches away from your belly button, scars, or skin with open wounds. If you are injecting more than one type of insulin, use different injection sites, as the insulins won't work as intended if injected in the same site together. For instance, give your basal or long-acting insulin on the left side of your stomach, and then give your bolus or rapid-acting insulin on the right side of your stomach. Insert the insulin pen into your skin straight in and not angled. Again, if there is not enough fatty tissue, pinch a 1 to 2 inch portion of skin in fat. Once the insulin pen needle is inserted into your skin, keep it in place and press the push button on the insulin pen all the way in, and maintain it pressed until the arrow next to the dial returns to 0. Keep it pressed for a full 6 seconds after the dial is at 0 to make sure all the insulin is injected. Now you can remove the insulin pen. A small drop of insulin may appear at the end of the needle. This is normal and can be expected. If a drop of blood appears on your skin after you remove the insulin pen, press the injection site lightly with a gauze pad. Do not rub the area. Once the injection is completed, do not recap the needle, as this can cause an accidental needle stick injury. Remove the pen needle from the insulin pen by grasping the sides of the plastic hub and twisting. Discard the pen needle into the sharps container. Place the pen cap back on and store the insulin pen in a safe location. Your insulin pen can be stored at room temperature below 86 degrees Fahrenheit for up to 28 days, away from heat or light. It is recommended that you keep your unused insulin pens in the refrigerator between 36 to 46 degrees Fahrenheit, as the insulin pens can be safely stored until the expiration date on the label. Never freeze insulin. When the insulin pen has been completely used up, it will not allow you to give any additional doses. At that time, you can discard your insulin pen with the pen needle removed into your household trash. The pen needles should always be placed into a sharps container. You have successfully given yourself a dose of insulin using an insulin pen. Good job. I thank you for your service to our country, and I'm honored to be of service to you this day.
Okay, and there's another video there you guys can watch whenever you want to. Now we're going to overview about the insulin pump. This is very much an overview. Your student's going to be getting an insulin pump. She doesn't have it right now, and so you'll have to be getting education for that specific one, but this is an overview.
Insulin pumps are small, computerized devices about the size of a small cell phone. They can be worn on your belt, in your pocket, or under your clothes. Most insulin pumps have tubing that goes from the pump to a site on your body where it's inserted. Insulin pumps deliver rapid-acting insulin through a small flexible tube called a cannula. The cannula is inserted under the skin with a needle that is then removed. The pump can be inserted on the abdomen, thigh, back of the arm, or back of the hip. The pump releases a carefully measured, steady flow of insulin through the cannula into your body 24 hours a day. This is called your basal rate insulin. The basal rate insulin can be adjusted for things like exercise and stress. Your insulin pump can also deliver your mealtime dose. After you enter your blood sugar and carbohydrate gram information into the pump will figure out how much insulin you need for your meal. This is called a bolus. When you are using an insulin pump, you must check your blood sugar level at least 4 times a day. You must also replace the cannula and refill the insulin every 2 to 3 days. One benefit of wearing an insulin pump is that you won't have to do regular insulin injections, although you may still have to do injections in emergency situations. Other benefits include a more flexible lifestyle, more precise insulin dose, and a more consistent and adjustable delivery of insulin. If you have any questions about the insulin pump, please ask your healthcare providers. They are happy to answer your questions and concerns. Thank you for choosing Cleveland Clinic for your care.
Okay, and you'll have to get more education on the particular pump that you will have access to. Appropriate snacks will be given at different points of the day according to the doctor's orders. And so you'll have to figure out what those are and keep those readily accessible for the student, depending on which classroom they're in. You also need to watch for some common signs of hyper or hypoglycemia. These are just some handouts that are available to you in the binder that you all have, going over the symptoms of what you might see if the blood sugar is too low, and then some treatment options and how to handle those situations. Your student has the continuous monitor, so you're going to know right away if they're too low, even before you even see the symptoms. And then same thing, if it's too high, these are the things you might see, and then what you would do in that case scenario. And there's more information on the back of these sheets in your binders. These are just some other videos that were really good. I'm not going to sit here and show all of them to you, but you guys can watch them at your leisure. These are the websites you can go to. There's a lot of educational videos out there. I'll just show this one.
Around 20,000 kids every year are diagnosed with type 1 diabetes. In addition to health scares, many parents face rising medical costs to save the lives of their children. That's exactly why two Coeur d'Alene kids are teaming up to help one of their friends and raise awareness for her disease. KXLY4's Katie Curry working for you with information that could save your child's life.
9-year-old Haley is a fearless fighter, but she was unknowingly fighting a losing battle.
She always complained of stomach ache and was always so thirsty and eating a lot of food and doing weird things in the middle of the night, like sleepwalking and wetting her bed.
It was at a Taekwondo competition last October where Lindsay Osborne really noticed a change in her daughter.
Made an appointment on Monday and we were admitted into the hospital on Tuesday.
Haley was diagnosed with type 1 diabetes. Every day since has been a learning curve.
This is the CGM. It's hooked up to a Bluetooth into Haley's stomach here, and every 5 minutes it gives her a blood sugar reading.
That's my other person. Being a single mom, it really helps me monitor her.
But insurance won't pay for the CGM. $400 a month out of pocket to operate a priceless device.
When you're doing it alone like Lindsay is, not only do you have to pay for rent and food and gas, but to add $400 a month to pay for something that's medically necessary is a big hardship.
Monica Oliver and her kids, Carter and Emmy, have seen the stress on their friends, from constant finger pricks and countless doctor's appointments to sleepless nights.
I don't like to say it around her, but I always worry if she gets too low in the middle of the night, if she's going to wake up.
Together, they launched Hope for Halo, selling bracelets and raising awareness for type 1 diabetes.
Hi! Have you met our friend Haley?
And in just 1 week, they raised $1,000. After a year of highs
$225.
and lows, they're no longer fighting alone.
If you would like to support Haley and funding her CGM, just head to KXLY.com. We've attached a link to a fundraiser where you can buy one of these bracelets, and all proceeds go to her fundraiser. Reporting in Coeur d'Alene, Katie Curry, KXLY4 News.
Okay, that's it. Just want to give you guys some words of encouragement. I know you already have a hard job, but I know that you love and care for your students. And I have no doubt that you guys will hit this out of the ballpark, taking care of your student. Thank you.